Many of my patients believe that all they need is to use the inhaler to control their asthma. However, for good asthma control, they should really be following a stepwise program. My name is Marcia Roy Madison. I'm a family nurse practitioner, and I'm going to explain to you what the stepwise program is. I'm going to go ahead and start by talking about the upper respiratory symptoms, because the upper respiratory symptoms is actually what causes the lower respiratory symptoms that triggers the asthma. So let's start with upper respiratory. So here's my patient. First of all, I look at the ears. So when I look down the ear canal, there's the ear, the wax is here, so here's the wax. I'm basically looking to see what this thing is doing. This is the tympanic membrane. The tympanic membrane, so I take my little otoscope with the light, I look down there, and I look to see what color this is. It should be kind of a gray color, which tells me that it's, healthy. Sometimes it can take on a little pinkish hue, and this is how we determine whether or not you have an ear infection or something going on. Then, so a lot of patients, they get diagnosed with ear infections when really it's more of a sinus issue. So if the ear looks good, if this tympanic membrane looks good, you might even have a patient that comes in with a goopy eye. Mom thinks that it's pink eye, but it's actually just sinus congestion. So with the ear, they may complain of having an earache. They woke up in the middle of the night with their ears hurting, but you looked at the ear with the otoscope, the ear was perfectly normal, but they're very congested. The next kid might come in with a goopy eye. The whites of the eyes are nice and clear, but there's a little bit of dry crust on the eyelashes. Mom thinks it's pink eye, but it's really from sinus congestion. You look up the nasal passages. The nasal passages might be really swollen on the inside. Okay, one side might be barely open, the other side might be completely closed. Again, sinus congestion. The same kid might be complaining of a nighttime cough. Now, this is where we're going to get into the asthma symptoms. So, or let's back up and say this kid has a sore throat. A lot of times when you have a sore throat, you're producing a lot more mucus and saliva than you normally do. Some of it you're going to swallow, but some may spill over into the lungs. So even if they have a sore throat, they may also have this cough. So now we're getting into the asthma symptoms. So mom is told, when you hear the child coughing, give them the inhaler. Mom thinks that the inhaler is some type of a cough suppressant. The physician or the pediatrician understands that when they start coughing, it's because this airway is about to spasm, because it's trying to keep out the mucus, and that's what's going to cause the wheezing. That's where the wheezing comes from, as the airway begins to spasm. And because this is the bronchi, that's the name of this part of the lung, this is the bronchi, we'll say they're having bronchospasm. That's what asthma is, basically, bronchospasm. So you pull out the inhaler in order to open the airway. I always say that Mother Nature forgot to give us the umbrella to keep the mucus out, and that's what's triggering the cough and the bronchospasm. Now, like I said, mom is going to think, I'm going to give them the inhaler, but she opens up the airway, she gets rid of the bronchospasm with the inhaler, but all she accomplished was pouring more mucus down into the chest. Now it's raining, we got all kinds of mucus coming down into the chest. Or maybe I should make that blue for air. Let's make it blue. Yeah, so all of this mucus is coming down, and this is what's basically causing the bronchospasm. So really you have to fix the asthma hair, you have to fix the sinuses, you have to dry up the mucus. Stepwise program is like going up the stairs and down the stairs, and that's why they call it a stepwise program. So you're gonna go up the steps and down the steps. Okay. On the first steps, we like to use antihistamines. We use Singulair. Singulair is also called Montelukast. It works at the beginning of the allergy cascade. What is a cascade? Well, if you take some dominoes and you line them up, cascade, right? So when you hit one domino, it hits that one, that one, that one, that one. With an allergy cascade, this has to happen for that to happen, for that to happen, for that to happen, for this to happen. And when this happens, this is when at the end of the cascade is when you get the sneezing and the wheezing and the cough and the rash is all the symptoms of allergies. We call it a histamine response. Histamine response. Okay, so these are all the histamine responses: the sneezing, the wheezing, the cough, the rash, the itching, the blisters. And this is any type of an allergy. It doesn't necessarily have to be asthma. Histamine responses is any manifestation of an allergic reaction. It can be, I said the blisters, the rash, the itching, the redness that happens, the swelling, redness, swelling is all the symptoms of any type of anaphylactic or allergy response. That happens at the end of the cascade. Singulair works at the beginning. So we put all of our patients on Singulair at night, and this is usually, they're usually on this year round. Singulair is an antihistamine that they should be taking year round at bedtime. It does cause drowsiness like Benadryl, but it does keep them nice and dry. So the patient is taking Singulair every night, the asthmatic, the child. Then they get into the season where they start getting the runny nose and the cough. And this is where you add the next medication on the steps, loratadine. Now, any of the antihistamines like Allegra, Benadryl, Claritin, Zyrtec, any of those will work on step number 2. Step number 2 works here. This is your antihistamines at the end of the cascade. So this is where your Zyrtec, your Claritin, your Allegra, Benadryl is going to start working at the end of the cascade. Singulair works at the beginning to control the symptoms. When you go through the flu season or the allergy season, then you add the antihistamine. So with the stepwise program, you should be on Singulair nighttime, then you move to loratadine daytime. Loratadine daytime. I like loratadine because it's non-drowsy. When I worked in pediatrics, we would put all of our kids on loratadine, and then when they were on that for a while, we'll switch them to Zyrtec, and then after a while, we'll switch them to Allegra, and then after a while, we'll go back to the loratadine. So this is something that the kids are on year-round if they have really bad allergies and really bad asthma. But again, you don't see me talking about the inhaler because these are the controller meds. We control all of this mucus drainage with the antihistamines. So this is why this becomes the controller, because it controls all of this mucus that's triggering the cough. Okay. Now, so you've already started on the Singulair. They've been getting that year round. They came into the allergy season where they're now using the loratadine, but they're still coughing. They still have the runny nose. It seems like nothing's working. So this is actually where you're going to bring in the inhaler at step number 3. So you do want to keep the airway open, because if they've been coughing for like 4 or 5 days and they've had all of these symptoms for 4 or 5 days, we're going on a week now, yes, they will start to have some bronchospasm. They may start to have some wheezing at this point after, 3 to 5 days of these symptoms. Maybe not on day 1, but by day 2, 3, they're starting to maybe have some bronchospasm if they're a true asthmatic. So we bring in the inhaler. Well, they're still coughing. Nothing seems to be getting better. Now it's time to make an appointment with your primary care doctor or your pediatrician to get some steroids, because now we're moving into a true allergic response. What I mean by an allergic response is, and this goes for any allergy, here's the immune system, okay? So here's the immune system. So we're looking at this area here. The immune system is kicking out these histamines. Okay, remember over here I talked about a histamine response. So there's histamine 1 and histamine 2. The histamine 1s are the manifestations of all those symptoms that I talked about over here. Okay, manifestation of these symptoms over here. So the immune system is kicking out the histamine response. It's also creating more stomach acid. We don't really focus on the stomach acid during an allergic response because we are going to treat this like an allergy. Your body is reacting. It's reacting as an inflammatory disorder. Okay, so it's the immune system in overdrive. The immune system's in overdrive. So at this step, when you go to see your doctor and you get the prednisone, this is to kind of suppress the immune system because the immune system's in overdrive. You're wheezing, you're sneezing, you're coughing. The immune system, the antihistamines don't seem to be working. So now it's time to go to your doctor or to the emergency room to get some steroids to reverse these allergy symptoms. This is what's going on, and reverse the wheezing. So now you have the prednisone on board. You're still using the inhaler. You're still using the Claritin and the Singulair at night. After 5 days of prednisone, a 5-day course of prednisone, now all the wheezing is gone. Now you could put away the inhaler. You stay on the Claritin for a few more days. Then you put the Claritin away. Now we're about 10 days out with these symptoms. And now you're back to just the Singulair. Okay, you're back to just the Singulair and all your symptoms are gone. So you went up the stairs and down the stairs. So this is what they call the stepwise program. This is what every asthmatic should be following. You should not just be pulling out your inhaler, using it, because you went up a flight of steps and you felt tired, or you ran around the track and you felt tired. That's not what the inhaler is for. The inhaler is for when you feel like you have a pillow over your face and you're really having a hard time breathing. We used to give out those little flow meters where you blew into the flow meter. It's kind of like a spirometer, but you would blow into it and it would tell you if you needed to use your inhaler. Unfortunately, I haven't seen those around anymore, but that's what we used to use to let you know when you should use the inhaler. We would also do an asthma action plan. And the asthma action plan is what every kid should get when they go to school, so that the teachers and the school nurse knows when to give the inhaler, when not to give the inhaler. So every child should have an asthma action plan. Everyone should be following the stepwise program, and we basically deal with the upper respiratory symptoms basically with antihistamines, not necessarily antibiotics. I hope this wasn't too confusing for you, understanding the stepwise program. Talk to your doctors and your pediatricians about the stepwise program and see if you could get your asthma controlled. The last thing I do want to say, if we're talking about an adult or a child, if you get to this level here where you're using the inhaler, you've tried the prednisone, your asthma is still not controlled, this is when we bring in the inhaled corticosteroids, the Symbicort, the Qvar, the fluticasone is the steroid inhaler. So if you're not being managed down here, then you go to the inhaled steroids. You're still not using the albuterol. Did you notice that? You're still not using the albuterol. You will go to inhaled steroids if we cannot control you with the controller medications. All right, I hope that helped. I hope it wasn't too confusing. Again, talk to your doctor about the stepwise program for asthma control, and I wish you the best with that.